So Carrie, I think one of the most important things about a child, bringing a child in at this age, is to teach them how to take care of their teeth properly by brushing, flossing, and eating properly. So we're going to go over some home care techniques.
Okay.
So Bella, can I have you tip your head back? I'm going to show Mommy. You can hold the mirror up so I can show Mommy also how to properly brush your teeth. So as you can see, she's kind of starting to get a mixed dentition. She's starting to lose some of her baby teeth at this point, and she hasn't quite started to, well, I guess I feel a little bump back there. So she's starting to get her 6-year molars. So we're going to make sure that you're brushing all the way back in the back and getting along the gum line on the inside and then the outside of your teeth. It's great to let her brush her teeth once a day, but I think it's really important for you to get in there another time just to make sure that she's gotten all the plaque off her teeth. The other thing that's really important, this is a great age to have them start flossing their teeth. I'm going to show you how to floss their teeth with just this normal floss, but there's also little self flossers that are perfect for children to learn to floss their teeth. So in the very back, these are 2 teeth that are going to be with her until about the age of 12. So important to make sure you get that contact clean and going in between at least once a day, getting that plaque out of there, because those teeth are going to hold the position for those permanent bicuspids. Same thing on the back. The front ones are also important, but if it's really critical to get this one contact. This tends to be the area where most children start to get cavities in between their teeth. The other thing I think is really important is for children to drink water and milk, and not so much juices, and absolutely very minimal in the pop department because of the high sugar and all those in the juices and also in the pop. Also, the water that you select should be fluoridated, either tap water or the bottled water that has fluoride in it.
Okay.
Okay.
And what about sealants? What are they?
Sealants are a protective coating that are put over usually permanent 6-year molars and 12-year molars as they come in. As these teeth that are in the very back start to erupt, we'll kind of monitor that, and as soon as the entire crown is erupted, we'll clean the surface really well and put a protective coating that will seal all the grooves and the crevices in the top of her teeth so that she will not get a cavity there. It's a great preventive program.
Are there certain foods that she should avoid, he should avoid snacking on?
Yeah, I know. That's a great question, and it's a tough one for moms because children are always wanting to munch on something, but if you can pick like the fresh fruits and stay away from the sticky fruit roll-ups that are so high in sugar. Those gummy bears, and they are very sticky and they stick on the top surfaces of the teeth, and they're really anything high in carbohydrates that are sticky are good ones to avoid.